You are on the road to better quality of life. It is important, though, that you have patience. Sometimes this process can take approximately 6 months in order to feel better. However, some patients even can feel better within the first month of treatment. You may also be prescribed medications in accompanying the allergy shots. Please take these medications as they are prescribed. It is important that you take these medications with the allergy shots. These medications can be anything from oral antihistamines, prescription nasal spray, and oral inhalers. These medications should be continued while the allergy injections are taking full effect. These medications also will help you in your symptoms and help you, in addition, to tolerate these allergy injections. We recommend that you have a follow-up appointment every 3 to 4 months, at least during the first year of your treatment. These follow-up appointments can help evaluate your progress, particularly during the first year. During those times when you come to see the provider, a decision will be made whether we need to change your medications, discontinue medications, or add new medications, depending upon your symptoms and your response to allergy shots. If you feel like you need to talk or to have an appointment with one of our providers because of a new symptom or because something is worsening, please feel free to let us know and we will arrange that appointment as soon as possible. Many times these appointments can be in the same day. Let's go over the supplies that you have. We have here a box that has vials. These vials are marked with colors, and the colors are blue, gold, green, red, and silver. You must always have an EpiPen in addition to that, whether you want to receive the injections here or somewhere else. And as you can see on the chart, the different colors refer to different dilution versions of the serum. The silver vial is the most concentrated, followed by the red, and it goes all the way down to the 1 in 5,000. The serum that you have here is specific to your unique allergies. Now, other allergy clinics sometimes may offer patients the same serum for the same allergies regardless of their individual needs. We at Allergy Arts, however, have chosen to make sure that your specific allergy needs are treated. Therefore, our serum or your allergy serum that we provide to you is specifically formulated and customized based on your reactions on the skin test. Other allergy clinics, they provide you with the same serum no matter what your individual needs are. Here at Allergy Arts, we have the serum formulated, specific, and customized to your allergy needs. This is based on the reactions that you have on the skin test. Clinical studies have shown that a specific allergen immunotherapy with standardized antigen can give you the best outcome in terms of relief of allergy symptoms and improvement in your quality of life. It is important to know that the goal of allergen immunotherapy is to reach a maintenance level or a maintenance dose while you are getting these injections. You need to know that the maintenance dose also is individualized. This dose is the dose at which your symptoms are well controlled without any reactions. In other words, you're tolerating the shots and you're not having any reactions. This maintenance dose normally occurs within the red or silver vial, either the red or the silver range. It is important to note that this depends upon your response to allergy shots. Some people require the injections all the way to the silver, others require it in the red, and other people, who are very few people, can perhaps do well just on the green vial, which is the concentration of 1 in 50. It is important that you gauge your symptoms and let us know how you are doing so that we can guide you as to where your maintenance dose is going to be. For few patients, as I mentioned, the green vial, for example, is the maintenance dose. This also, therefore, depends not only on how you're responding, but on your tolerance of these allergy shots. A maintenance dose is the dose at which your symptoms are well controlled and you are tolerating the allergen immunotherapy without any symptoms. In other words, you have excellent quality of life and at the same time you are tolerating these injections. As I mentioned earlier, Usually this maintenance dose is the silver in most of these patients, followed by the red, and few patients will have perhaps lower maintenance dose, such as the green. Now, based upon your symptoms, the maintenance dose can be given every 7 days or up to every 21 days. In other words, it can be given every 21 days or every 14 days or every 7 days. Many patients are comfortable receiving these injections every 2 weeks. Few patients like to receive them every 21 days. And it depends upon the free time or the time in which you don't take these injections. If your symptoms are active during those times, then you know that you have to have more frequent injections to control your symptoms. Even if you are taking allergy injections every 21 days, there are times, or at least certain seasons of the year, when your symptoms are more active, and during those times you may need to increase the frequency of these injections, perhaps to every week, to keep your symptoms under control. We call the times at which you have to increase your frequency of injections, we call them flare-up of allergies. Flare-up of allergies can be prompted, or at least prompting you to increase the frequency of these injections. After these things improve and you are doing better, you can go back to every 21 days if you are out of your season and if you feel like your symptoms are better controlled. While you are building up on the allergy shots, it is important to wait 24 hours between injections. That would be our recommendation. Most of our patients follow a regimen in which they take the injections on Monday, Wednesday, and Friday, for example. This way, you will go through the schedule from the blue, gold, and green until you reach your maintenance, probably within 4 weeks. If you cannot come during those times or 3 times a week, please try to come at least twice a week. Those times will help you achieve your maintenance dose approximately within 6 weeks. Sometimes it can be as long as 8 weeks or more. Our clinic is open on those days, and the times and days are indicated in your literature. We prefer that you make appointments with us so that it would be easier for us to prepare the serum and remember your schedule. But walk-ins are also accommodated to come in and get your injections at any time. If you miss a shot up to 7 days from the last injection, we have to make sure that we decrease your dose according to schedule. And this is only during the build-up phase of the allergy injections. Refer to your packet to make sure that you know how to reduce the dose. It has a schedule and tells you exactly how to reduce the dose if you miss more than 7 days while you are being built up towards maintenance. However, if you miss more than 60 days, unfortunately, you have to start all the way from the beginning in order to achieve maintenance. If a reaction occurs, we need you to notify our office. And if the reaction is worrying you, or you would just like one of our providers to have a look at it, make sure that you simply call our office, and we will be happy to accommodate you at any time to evaluate these reactions during our office hours. Your serum dilutions will need to be altered sometimes, depending on the kind of reaction, the severity of the reaction, and the location of the reaction. It is important that if you have a systemic reaction where you have problems breathing, it is important that you give yourself the EpiPen and call 911. If you cannot give yourself the EpiPen, make sure that somebody else can give you the EpiPen, and again call 911 as is outlined in your packet.
Reactions include local redness, itching, warmth, swelling, pain with injections, breathing problems, and hives. You may use over-the-counter Benadryl cream or hydrocortisone cream to relieve discomfort related to redness, itching, warmth, or swelling. An ice pack can also be applied to alleviate swelling. You may also take a Benadryl capsule or other antihistamine ahead of time on the day of your injection to relieve potential symptoms. Ethyl chloride is helpful if you experience pain with injections. If you experience a burning pain when you reach the red stage of injections, you may begin to add lidocaine, a deadening medication, to your regimen. To acquire a prescription for lidocaine, please call our office.
Once you get breathing problems or hives, these are signs of a more serious and fortunately very rare systemic reaction. This type of reaction is referred to as anaphylaxis. Signs of anaphylaxis usually occur within the first 20 minutes, and that is why we stress that you wait the 20 minutes, or stress that if somebody else is giving you the injection, to make sure that the person accompanying you wait the 20 minutes. They can also occur after 5 to 10 minutes after the injection. It is very important that we recognize these reactions immediately. All patients are given a prescription for EpiPen. It is important that you fill this prescription and have an EpiPen with you at all times, particularly on the day of injection. It is very rare to have any serious systemic reaction, and we hope that you never have to use the EpiPen. However, think of it like your seatbelt. You use the seatbelt even though you are not going to go into an accident, but at least it'll protect you if you are in an accident. This is the same thing as carrying the EpiPen. Fortunately, these reactions are rare, and you need to be prepared if something like that happens. The most important take-home message is to wait the 20 minutes and keep an EpiPen with you at all times. This will help protect you in case of a serious reaction, which, as I said, is extremely rare. It is important that you continue on these allergy shots for at least 3 years. In other words, a minimum of 3 years. Clinical studies have shown that if you stop these allergy shots before 3 years, there is 60% chance that your symptoms may come back. However, if you stop them after 3 years, there is less than 10% chance that these symptoms may return. Some patients, however, may require allergy shots or immunotherapy for more than 3 years. We are recommending that the injections continue at least 3 years and hopefully a maximum of 5 years. We have to keep in mind that allergy injections for longer than 5 years may be appropriate for few patients who require them on a regular basis. The World Health Organization has approved that some patients may require these injections for more than 5 years, and it is acceptable. It is sort of like giving a vaccine for a prolonged period of times for the few patients who require them for that long. After all this, we at Allergy Arts are excited that you are going to be on your way to recovery and improving your quality of life with these allergy injections. Myself and all the staff are here to assist you and be a support for you during all this time while you are a patient at Allergy Arts. We hope that this presentation has been helpful, and our nurses and our providers are very happy to answer any questions that you may have.